Hi, I'm Erica Plybier, founder of MedHaul, where we believe that everyone deserves safe, reliable, and efficient transportation to care regardless of special need. Prior to MedHaul, I spent 8 years in clinical and research informatics building software solutions for some of the biggest names in healthcare like Google Ventures-backed Flatiron Health and St. Jude Children's Research Hospital. So imagine my surprise and frustration when I couldn't find an easy way to transport my grandmother, who was a type 2 diabetic double leg amputee, without lifting her in and out of our family vehicle, which was not wheelchair accessible. I knew there had to be a better way to find and book personalized, complex transportation, and I also found that millions of people across the country face this same problem. Actually, about 197 million people, that's 60% of our population, have chronic illnesses that require daily or weekly doctor's appointments, and about a third of those miss due to transportation barriers like not having a car or the appropriate vehicle or money to pay for public transportation. And these are critical appointments that can't be missed. So think about a cancer patient missing her chemo appointment or someone with kidney failure that can't make it to dialysis. These patients many times can't just drive themselves or take public transportation, especially now with the pandemic. And if these patients miss these appointments, they often end up calling 911 and going to the emergency room for what should have been a routine visit. These missed appointments and the misuse of emergency services are really hurting our healthcare system, creating an avoidable expense of over $180 billion per year. Hospitals and insurance providers have tried to find suitable transportation solutions for these patients, but their methods are so outdated and inefficient, usually requiring long phone calls, stacks of paper. And the thing is, these patients still continue to miss these appointments. Healthcare providers are still losing time and money. My grandmother, these patients, and our healthcare providers deserve better. So we built MedHaul, a tech-enabled marketplace that makes it easy to find and book high-quality special needs transportation. In just a few simple clicks, we connect nursing staff directly with transportation partners who specialize in door-through-door transportation for patients with complex needs such as wheelchair, stretcher, or even isolation. Our technology also captures additional unique information. So, does the patient own a wheelchair or will they need one? Are there stairs in or outside of the home? Ensuring we connect these patients with the best transportation providers for their needs. And on the back end, we use machine learning to provide reporting and insights to customers and transportation partners and constantly improve our ride matching capabilities. Our team knows the population that MedHaul is built to serve. We have over 50 years of combined experience in healthcare technology, operations, data analytics, and product management. We've successfully led over $700 million of complex projects for world-renowned healthcare institutions and Fortune 500 companies. We've built tech products from the ground up, and we're super excited to transform this massive special needs transportation industry. Honestly, other companies have tried to tackle various transportation challenges, but MedHaul is the first to build a solution that focuses on personalized, complex transport in vulnerable communities. Healthcare providers prefer to work with MedHaul because of our simple, predictable subscription business model, our unique vetting process for finding reliable transportation partners, and the wide variety of accessibility options that are offered on our platform. The medical transportation market is huge and rapidly growing. The U.S. market is estimated at $21 billion and expected to grow to $31 billion by 2026 due to the growing baby boomer population. MedHaul is targeting the $10.3 billion non-emergency medical transportation market, and we're getting there first by targeting specialty groups like dialysis and cancer centers in the 11 southeastern states. And we've already done quite a bit to get there. Since our formal launch in 2019, we've secured 4 enterprise customers. We've facilitated over 7,000 rides through our platform, and we've saved our largest customer almost $2 million within their first year with us, and we're not stopping there. We're looking to expand our impact, targeting 200 enterprise customers and over 500,000 rides and 80 million ARR by 2025. We have a huge mission, and we can't do this alone. We're extremely honored to be backed by Morgan Stanley, Inova Memphis, and most recently, the Google for Startups Black Founders Fund. We're looking for additional partners to help us refine our technology, grow our transportation network, and reach 110K in monthly recurring revenue by December 2021. I honestly started MedHaul to build a transportation solution that I wish was available for my grandmother, and now I'm driven to scale our company to impact the hundreds of millions of families across America who need our help. Thank you for your time today.